We're here tonight to give you all a bit of an update about the overdose surge that we've been experiencing in Austin and Travis County. And we'll just sort of update you all as to where we're at now compared to the press conference that we had yesterday. Before we start, again, we're EMS as opposed to APD, so we're not going to be able to answer any questions about the investigative side of things. But I do have a statement from APD that they asked me to share with you, so I'll do that now. As per the latest update at yesterday's press conference, APD has detained 2 individuals who are believed to be persons of interest. The Austin Police Department's Narcotics Support Unit is actively pursuing leads to locate and arrest those involved in the distribution of illicit drugs that have been adversely impacting our community. Since the case is still ongoing, we cannot disclose any further information at this time to maintain the integrity of the investigation. We will provide updates once more information becomes available. So with me is Division Chief Angela Carr, who's the Division Chief over Integrated Services, and Chief Deputy Medical Director, Dr. Heidi Abraham. Angela Carr is Angela Carr, and Heidi Abraham is Heidiabraham. So with that, I will pass it over to Chief Carr.
Around 9 a.m. Monday morning, the city experienced a sudden surge in opioid overdoses, initially concentrated in the downtown area and then later spreading throughout the city. As of 6 p.m. today, Austin Travis County EMS has responded to 75 suspected overdoses. And unfortunately, we are suspecting around 4 deaths from this surge so far. Austin Travis County EMS, along with our partners with the Homeless Strategy Office and Urban Alchemy, deployed as rapid response teams to the affected area on Monday morning and continue to visit with clients and canvass hotspots handing out Narcan. As of this afternoon, we have distributed over 400 doses of Narcan in just over 48 hours. And we're happy to report that it appears to be making an impact. While we continue to see overdose cases across the city, the incident numbers are declining. We've seen just 7 overdoses today compared to 37 on Monday and 27 yesterday. Dr. Abraham.
All right. Obviously, the safety and well-being of our residents are our top priorities, and we are continuing to work diligently to address that crisis. But how can y'all help as community members? Well, I would encourage you all to recognize the signs of an overdose and learn some very simple steps to help save a life. An opiate overdose is a life-threatening condition, but it can be reversed if the patients are treated immediately with Narcan and emergency medical care is contacted. So everyone should familiarize themselves with the signs and symptoms of an overdose and be prepared to call 911 immediately if they see somebody experiencing those symptoms. The symptoms could include shallow or slowed breathing or not breathing at all. What we call pinpoint pupils or really, really small pupils. The person may change colors. They may turn blue or purple, especially if they're not breathing adequately. They may be confused, and they may be completely unconscious. Again, I want to thank our public safety partners. Austin Fire Department and Austin Police Department have been really helpful to us, especially getting on scene first and administering Narcan. They've definitely saved a number of lives through their interventions. I also want to encourage anybody who may be struggling with opiate overdoses. There's a lot of resources here in the Austin Travis County community to help you recover from that. So reach out to a lot of those different community resources. And then finally, obviously, we would never encourage folks to use unknown substances or take medications that have not been prescribed them from a physician. But for those who are going to use those drugs, we encourage folks to start low, go slow, and never use alone. You should always have a sober friend with you who has Narcan available and can call 911 if necessary.
Okay. Does anybody have any questions?
You talk about just overdose response over the years here in Travis County. I think last time I talked with you all about 3 months ago, it said it was an uphill battle, and you're seeing overdoses sometimes that don't get, reported. Are you seeing an increase over time?
So we've actually been doing fairly well lately. I think that's in large part to the work that our community health paramedic team, as well as our harm reduction partners, have been doing. That said, before this surge, we were mostly seeing the numbers trend at least a little bit downwards, and the same goes for deaths. Unfortunately, what started Monday happened, and here we are. But it's a fluid situation, and as science progresses and the people that manufacture illicit substances progress, they're going to figure out different ways to continue to do this kind of thing. So we just have to be ready for it. We would all like to live in a world where we don't have any opiate overdoses, but we don't live in that world right now, so we're going to do the best that we can.
Regarding the fatalities specifically, you mentioned 4 fatalities that you can tie to the overdoses. We'd heard earlier in the week that there were 8 total, that 4 were still kind of pending, like exactly what the cause was. Is that still the case, and can you speak to that a little bit?
Yeah, so the discrepancy between the 2 numbers that have been reported are the 4 cases that Austin Travis County EMS suspects to be overdose-related deaths, and the 8 that the Travis County Medical Examiner reported. So the difference between those is it boils down to a number of factors. It could be the way that the call was triaged. That's how we collect our data. So if somebody is in cardiac arrest and a bystander calls 911, but nobody knows how that person got that way, and there's no context clues around them as to how they're in cardiac arrest, we may not necessarily know that that person is in cardiac arrest as the result of an overdose. The medical examiner obviously has lab testing and toxicology. They have investigators that go out and make contact. They go to scenes. They make contact with family members and friends and get a real solid history of those patients. So they're able to determine that far better than we can with just what we see when we get there.
So the medical examiner has confirmed on their end that all 8 are opioid related?
So I can't speak for the medical examiner, but I do know that those 8 were suspected to be opiate related.
Okay, and your 4 are obviously part of that 8.
Correct. Yeah, and just to clarify a little bit further, because this question keeps coming up, and I know it's difficult to understand if you don't necessarily speak public safety, but the 8 cases that the medical examiner has, we're not saying that Austin Travis County EMS did not treat or pronounce those patients, because we did, with the exception of some very small areas. Anybody that dies outside of a hospital in Austin or Travis County is going to be responded to by Austin Travis County EMS, and we're going to pronounce them deceased if that's the outcome. It's just those 4 cases are ones where we didn't suspect overdose, either because there were no clues or because somebody had perhaps been deceased for a while, and we got there and pronounced them without attempting to resuscitate them, as opposed to, when somebody goes down with a bunch of people or paraphernalia around, and we can draw that conclusion.
I'm sorry if you already mentioned this, but did you say the city is the city opening up some sort of operations center during this period right now, if you possibly see an increase?
So, the city and the county are both continuously standing by to support us. We cannot say enough about the support that we've received from both the city and the county, as well as our partners. And to be perfectly honestly with you, like Chief White said yesterday in our press conference, had it not been for the foresight of our city and county leaders empowering us to have the programs that we have, the death toll that we've seen would be much higher. To speak to the operations center piece, like I said, the city and the county have been very supportive, and at the second that we reach out and we say we need to escalate this, they're going to be there to do that.
You talk about, I know y'all are always there to save lives, but call volume, something like this, when there's multiple people overdosing, deaths, what does that mean for other community members, heart attacks, other emergency calls? Does that put a strain on your system?
So it certainly has the potential to. We got pretty lucky this week in that, especially on Monday when all the cases started, they were fairly concentrated into specific areas. So, we don't just have our paramedics on the ambulances, we have our community health paramedics, we have commanders out running calls and jumping those incidents. So, with those that tight geographic location, they were able to go very easily and quickly from one call to the next. If that was truly spread completely across the city in all different corners at the same time, it would absolutely put a strain on our resources. But we have great relationships with our other public safety agencies. As Dr. Abraham mentioned, our police department and fire department partners have been instrumental in helping us mitigate this. But we also have mutual aid agreements with outside agencies that we could call on if it got to that.
You mentioned
Victims-
cluster. Oh, sorry.
Sorry, just to follow up, just the victims in this case here, people who were overdosing. 3 months ago when I talked, it was a lot of the homeless camps, homeless population experiencing this same thing here, or was it just kind of widespread?
So I want to stress that opiate use disorder and overdoses does not discriminate. It doesn't only affect the unhoused population. It does not only affect a specific racial or age demographic. It affects everyone. We have gotten very lucky that we haven't seen any deaths in anyone under the age of 18. But outside of that, this spans all racial, age, socioeconomic demographics. We have had people who overdose at home. We've had them out in public. We have had them at their place of work. So it's affecting the entire community.
The reason I asked this question is the Urban Alchemy, last time I spoke with them, saying that there were drug dealers targeting the homeless population in that area. Is this a targeted group? I mean, were you seeing, homeless population targeted in this?
I mean, I can't speak to whether or not somebody was targeted. That would be on the investigative side. But what I can tell you is there's a reason that we consider our unhoused population a vulnerable population. And that's just one of the many reasons. They are vulnerable to lots of things that people with resources aren't vulnerable to. And this is no exception. John, did you have a?
Yeah, just as far as the location goes, you mentioned it started in downtown and kind of went to other areas. Are there any specific other areas where it's been kind of more prevalent?
Yeah, so after it started to sort of spread from downtown, we did see a high volume in the East Old Torf area, east of 35, out to Burleson Road. We've also seen a couple of clusters up on the north side and then far south Austin. And then far east Austin. If you look at the press release that we sent after the press conference yesterday, we actually made a heat map. It hasn't been updated as of right now, but it gives you a good idea, and we're still seeing it across the city.
How significant is it to see something this dramatic? Are there other instances, just kind of off the top of your head where, you've seen a spike to this degree?
So we haven't seen a spike in overdoses of any kind like this since we dealt with K2 in 2015. I cannot think of a time where we had this amount of opiate overdoses in such a short time. And obviously the K2 piece back in 2015 was an opioid, but we mentioned yesterday, and I think at the briefing on Monday, that one of the things that we're seeing with this particular surge is that these people are not necessarily attempting to take an opiate. They're using K2, they're using crack cocaine, Xanax, a number of other substances. So it is whatever is doing this is making its way into everything. And that's why we need everybody to be alert and to know what to do in case they see somebody.
Has EMS seen any pediatric patients in this outbreak?
We have not seen any pediatric deaths. I believe we had one patient that was in their late teens, but no children, certainly.
Have any of the patients possibly disclosed kind of like where they might have picked these drugs up?
That would be a question for APD. Anybody else have anything, Nabil?
Can you just talk to the importance of Narcan and the change, maybe shift in the county on putting more resources, efforts? I mean, we're seeing places you can pick it up at UT's campus. I mean, is that helping? Is that education going to change things?
Unquestionably, it's helping. We've seen in just a couple of days the numbers dramatically decline. That's a great thing, and I think that speaks to the incredible work that both our community health paramedic team and our partners have done in essentially flooding the city with Narcan. It's so easy to use. You you don't hardly need any training, and if you do, there's step-by-step instructions on the box. It certainly makes a difference. We have seen a number of cases where Narcan has been administered by civilians before we get there, and either the person is awake and is recovering, or they are well on their way to recovering. We've actually seen a couple of cases where they've recovered fully and walked away before we got there. So it is absolutely making a difference. All right, anybody else? Kayla, did you have anything?
Yeah, a quick question. What do you say to the critics who may say that, like, by distributing Narcan, you're encouraging more drug use?
So we're EMS, right? We're in the business of saving lives. Our job is to do everything that we can to prevent preventable deaths from happening. Narcan is just one of the many tools that we have at Austin Travis County EMS. We have a number of programs housed within the community health paramedic program that do an inordinate amount of incredible work combating the opioid crisis. But, you know, to somebody that says giving Narcan is just encouraging, people are going to use. We don't want to see people die unnecessarily. And that's why it's so important. I guess the question is, do you value the point that you're making by criticizing Narcan, or do you value saving a human life? And I know that I speak for our department when I say that we absolutely value saving a human life.
One last thing, you mentioned some of the stuff out there. A lot of these drugs that people are taking, they might not really assume it's in these specifically, even what it looks like a prescription medication. Can you elaborate a little bit more on what you've kind of seen out there?
Yeah, absolutely. So like I said, we have seen these overdoses happen as the result of people using something other than an opioid. So what I would say to anyone taking any substance, if you are going to use, like Dr. Abraham said, start low, go slow, make sure that you have somebody with you that has Narcan and can call 911 if you need to. I would also add that for anybody that is taking a medication that they think is prescribed to somebody else, you should never take a medication that is not prescribed to you by a physician and dispensed by a licensed pharmacy. Otherwise, you're playing with your life. And I think that, what's happened lately sort of drives home the point that one pill can kill, any substance can kill at this point.
Does it appear that fentanyl is likely the culprit in almost all of these, or can there be other, like, synthetic opioids that how much is known about that at this point?
So there are other synthetic opioids. We know that there are others that mask that mimic the same signs and symptoms. Fentanyl is out there. It's in a lot of things. I can't speak to the toxicology piece, but at EMS we have a pretty high index of suspicion that that's what it is. And unfortunately, everybody needs to be vigilant, because unless you know exactly what it is you're taking, you don't know exactly what it is that you're taking.
Has fentanyl changed the way y'all respond or trainings in the last few years here with the epidemic?
Yeah, I think it's certainly increased awareness. It's one of those, hot words that almost everybody knows now. One of the things that has sort of been put us, not necessarily to disadvantage, but made things a little bit more complicated for us, is that when fentanyl is used properly and made by a pharmaceutical manufacturer, it is a perfectly safe, very useful analgesic when it's administered by somebody that's trained to do so in a clinical setting. We carry fentanyl on the ambulances. It's a great analgesic or painkiller, for acute trauma and cardiac symptoms and things like that. But again, it's manufactured professionally by licensed manufacturers. We use it in very small amounts, and it's regulated to the right concentrations, as opposed to things that are manufactured illicitly. You don't know how much is in what dose, I guess. But if it's used properly by medical professionals, very safe and useful. If it's not, it's a gamble. All right, anybody else? Good? Okay.